All right, good evening, everyone. It's time to check in again with the data and see how the data are looking. This is now August 10. It's been about 2 weeks since I last talked about the data. I made a few mild predictions because I'm always scared to go too far out on a limb. But I do want to say that the data, looking at the data now, is doing about what I expected. And actually, I've seen some good things, a drop in hospitalizations. The other data is a little bit harder to interpret, and we have seen a rise in deaths, but I want to try to put that into context from what we expect from the other streams of data. I also have 3 questions that have come to me from different sources, including my own pastor for one of these. The questions are, what do we do with all this conflicting information? So I'm going to focus on the big problem states that I defined in the last data update, and then I'm going to go to the 3 questions that we're going to answer. You can click to each question. I'm going to make it a separate video. For the last question about what's the best evidence for why I should wear a mask, I'm going to talk about that from the perspective of science in one video, then from the perspective of the Bible. I'm going to go to 2 Timothy, and where St. Paul talks to Timothy about something that resonated with me when I was thinking about this very debate. So we'll get to that when we get to it. As always, if you have questions, do send them to me. But my question is, what's the data doing? And the data is actually going down in all cases but deaths at this point. And deaths are potentially flattening out right now. So I've got to say that's better than going up. And so what I'm going to say, remember that we have a second wave. We had cases and hospitalizations and deaths go down, and then they went back up. Cases went up a lot, hospitalizations went up still a lot, but less, and the deaths went up, but not as much. You can see it in the gray part of this graph. In fact, let me zoom in on that. Let's zoom in on hospitalizations and deaths. The main thing I want to show you here is hospitalizations are going down, and deaths may be peaking right now. We just had it's too high by any reasonable reckoning, but at least it's not going up at the same rate. You see how I'm having to walk the line of, this is not good to have this many things, but at least it's not as bad as we were worried about in some cases. We are not seeing New York City repeat itself over and over again. Instead, we're seeing something bringing down the hospitalizations in our 4 big problem states that I've been tracking. And so I want to go through the data really fast, assuming that you can pause on it. For the hospitalizations, it's a pretty significant decrease. I consider anything less than 10% is probably noise. But these hospitalizations have gone down by 20% since their peak on July 24th. In fact, it looks like they got up to about the same peak that they were before. Now remember, previously they were concentrated in the New York City area, over a couple of states in the Northeast. This is being concentrated over a much broader area, so these are more geographically dispersed, but still, it's way too many people in the hospital. At least that number has gone down by 20% since July 24th. And remember also that these 3 streams of data are relatively independent. You can talk about, do I trust these data or not? But these come from 50 different states, and they come from 3 relatively independent streams of data. And the streams of data also go together. We're seeing the cases and the hospitalizations change with a reasonable timing pattern between them. And the deaths are hopefully going to fall because they've already flattened out in a reasonable pattern. So on my last data update, I had this slide where I said, will we see 500 deaths a day or will we see 2,000 deaths a day? It looks like if we are indeed near the peak and the flattening out in the death curve is what what the models predict, then that means that we are flattening out at about halfway between those 2 things, and thankfully a little bit on the lower end between those 2 possibilities, 1,100 deaths per day. Again, this is way too much. And we have to put this in the context of 330 million people in this country. We're going to definitely exceed 200,000 official deaths from this disease, and excess deaths suggest that there are even more than that. But we're getting down to the point where we can see the second wave is smaller than the first. And I have to take that as not good news, but not as bad as it could be news, okay? So these are my questions I have from July 18th, and I'm going to answer my questions. Is Arizona's drop in hospitalizations and cases real? Yes, it is. Will Texas remain flat? No, it actually will drop. Will Florida slow down? It slowed down so much that it would drop. I didn't even think that it would go flat in this time. So Florida has actually dropped faster than I thought I was. I was too pessimistic about Floridian hospitalizations. And how big will Louisiana's second bounce be? And it looks like that's topped out and is coming down now. It's not going to be as big as the first. And how does the second expansion relate to the first? That was my question that I asked. I got that answered by an account I follow on Twitter, and that's going to be my first mailbag question. I get to answer my own question first. I run the podcast. That's the way it works. So let me just quickly show you these, and just remember the orange line is positive tests. The purple line is currently hospitalized patients, and the red line is deaths as you go from left to right. So if you look at this, you see all of them are going down in Arizona. The numbers topped out in about 100 to 200 deaths a day. Thankfully, that is going down. California, you see that purple line is going down, and I'm hoping that the deaths line, the red line, is starting to go down as well. We're seeing this, the most important thing to me is the purple line. Each of those is a COVID patient that's been reported by the hospital, has been serious enough to be admitted to the hospital. This is a sign that this is the bad disease that we want to avoid. Florida, you see a similar drop. And again, I was expecting this to top out around 11,000, 12,000. Instead, it topped out at 9,500 and has been going down consistently. Notice how these curves go up and down a little bit day to day, but overall, when you sit back and look at them this way, you do see a trend that is a relatively simple curve trend. That's one sign to me that these are real data, because this is what real data looks like. By the way, there are other tests we can do to say, are these really real data or not? And those tests seem to be mostly passing when we look at all the data in aggregate from our country and from others. Texas has gone down as well, and so you see that they've gone down quite a bit from peak. They're a bigger state, so they have a little bit more healthcare capacity, and hopefully those deaths numbers will start coming down. Texas has a bit of weirdness in how they report the deaths. They change the way they report the deaths, and that's the thing about all these data. They change the way they report. They're forced to change the way they report. But when you step back and look at this on a week-to-week, month-to-month basis, that's where you can be pretty sure that you're seeing a real pattern going on. Washington, again, I have to return to my home turf, and we have seen a resurgence in cases, but that case number has gone down. The hospitalizations, again, they've gone up to about 400. Realize this is a far cry from what Texas and Florida are doing, which is in the tens of thousands or more than tens of thousands. We have 400 in Washington. It looks like things are run under control, definitely relative to the rest of the country, and hopefully flattening out and starting to go down. The deaths line, the red line, has been pretty flat, pretty consistent, a drumbeat of fatalities from COVID-19. But again, at least it's not exponentially rising. Remember, that's the whole fear that we had going into this. Here's at the county level for the two Seattle area counties that I track most closely. I record these data every day from the counties. And the other thing that I add is that our governor has added 2 more thresholds. I've talked about the low risk threshold before. He's added a moderate risk threshold, which is 75,000 cases per 100,000 people per 14 days. Okay? I calculated out what that would be on a daily rate, and you can see that we are still above the moderate risk threshold for both blue King County and orange Snohomish County. But we are hanging out right above that, and if you look at the data, it's definitely flat, probably decreasing. So I'm hoping that we will become moderate risk relatively soon. Notice that these data are following a general trend, and this is not exponential growth anymore. Whatever this is, it is not the thing that we most feared. Hospitalizations follow this curve as well. King County reports them in this way, so I can easily make a graph. I also have Snohomish County. If anything, Snohomish is better than King. And you see that those hospitalizations, they have gone up slightly. It's accurate to say they were rising, but they're rising from a level of about 5 per day to a level of at most 10 per day. So they doubled, right? But it's a very low level for a county with 22 million people, or 2.2 million people. Sorry, I said that wrong. And then the last state I want to look at is Louisiana. But you see here that we have the earlier peak and the later peak. It's definitely of a magnitude and pattern that we haven't seen. They had an outbreak in New Orleans, and then they had an outbreak, they had another outbreak later. But this outbreak was not in New Orleans. I'm getting a little bit ahead of myself. This is the one case where I can say truly they have a second wave. If you look at Florida, Texas, California, they didn't have anything this high early on in April. They're hitting the high point now. Louisiana hit the high point, and then they came back. And our question is, okay, what's it like when it comes back for a second time? And that's my question that I had, and I'm going to address that in the next data update that's coming up next.